Absence of evidence does not mean evidence of absence. That is what I was fighting with ChatGPT, okay, recently as I was preparing for one of my other videos when I was getting sources about digestive enzymes. And so let me repeat that again because it is like a little tongue twister there, okay? Absence of evidence does not mean evidence of absence. So what does that mean? That means for those of y'all who like to be scientific and you always want to say, hey, where's the research? Well, this is a research principle. Absence of evidence does not equal mean evidence of absence. Okay, if there is no evidence, let's say you say point A, there is no evidence. Okay, that does not mean that point A is wrong. Just because there is no evidence to say point A is wrong or right does not automatically mean it is wrong. So I was having an argument with ChatGPT, okay? And you can use this example to actually talk with your healthcare practitioner, your physicians, or anybody who says, hey, what you're doing is wrong. Okay, the evidence show that you should be doing this. But here's the problem. They don't show you the evidence to say that what you're doing is wrong. They will only talk about evidence that is what they believe in. Let me give you an example, exact detail of what I was arguing with ChatGPT. I was saying, hey, pineapple. Pineapple has a digestive enzyme bromelain. Bromelain comes in capsules, right? Supplements. There's all these supplements with digestive enzymes, and they don't put pineapple into the capsule. They extract that enzyme and put it in a capsule. So I'm saying, what's the difference, right? I'm asking ChatGPT, what's the difference between bromelain in a capsule versus a pineapple? And ChatGPT says there's no difference. That, in effect, is wrong. Okay. But when I asked ChatGPT, what did ChatGPT said? There is no evidence that the pineapple does more for digestion than a supplement of bromelain. That's what ChatGPT said. So they're saying it's the exact same thing, but the reality is it's not. Okay. And now what was their evidence that they had? They don't have any, right? Which is what ChatGPT told me. There is not enough research to prove that pineapple can actually help your pancreas heal and therefore produce more digestive enzymes. And because there's not enough proof, ChatGPT told me eating a pineapple is no different than taking a capsule. But we all know common sense. Common sense, eating a pineapple versus taking a supplement of bromelain, just the enzyme, is drastically different. And a bromelain enzyme is not the same thing as a pineapple. The pineapple has so many nutrients. So I was arguing with ChatGPT. I was like, how can you say that? ChatGPT's whole basis is this. And many people with who only believe in clinical research, they all will also say the same thing at ChatGPT. This is what they'll say. There has not been a lot of clinical studies done, double-blinded studies, random clinical trials done on pineapple helping the pancreas heal and helping the pancreas secrete more digestive enzymes. So most people stop at that. But here's my argument with ChatGPT. I asked ChatGPT, where is there research done, human clinical trials, double-blind studies that prove pineapple does not help the pancreas heal? What did ChatGPT come back with? There is no proof. And what's the lesson from this? Number one, you can't trust everything what ChatGPT says. It is skewed. It's skewed towards Western medicine and clinical research. So here's the reality. We all know not everything has been clinically studied, right? I say many times, Chinese herbs are going to be the last thing people clinically study. There is a lot studies done, but society, medical associations will always do clinical studies for medications first before they do anything for anything natural, right? Why? Because you can't patent something that's natural. You can patent something synthetically made. But that's another topic. Let's come back to, so number one, don't trust what ChatGPT says. You need to think about what they said. ChatGPT said, a pineapple is no different from a supplement. Pineapple cannot help your pancreas heal. It cannot help your pancreas produce more digestive enzymes. And when I asked them what's the proof, They said they don't have any. So then I went back to ChatGPT and I said, hey, if you don't have proof to say that pineapples 100% cannot help a pancreas heal, you should not be telling me eating a pineapple could never help the pancreas heal because you have no data, you have no clinical studies, right? So whenever you are doing something and that your practitioner, your healthcare practitioner, your physician tells you, hey, the research says you should be taking this medication and not eating this fruit or not doing this herb, this is what you can do to engage a conversation. I would ask that physician, do you have proof to show me that doing this herb 100% will not help me with my X, Y, Z? 100% guarantee you they will not have that. So what did I say in the beginning? Absence of evidence. Just because there is no evidence, there's no clinical studies done on a pineapple helping your pancreas heal, that does not mean that the evidence of absence. That does not mean that a pineapple cannot help your pancreas heal. I hope you can get this point. I hope you're not confused by what I'm saying. I just found this really interesting how, a lot of the AI and large language models, they're funded by conventional medicine, big pharma. And so they're going to skew towards that. So you have to push back a little. And you also, with your practitioners, including if you come to our clinic, you got to push back on our team, right? That's why if we ever meet, you tell me, hey, I'm doing this one thing and it's working great. And if I ever tell you, no, it doesn't, you're lying. Shame on me. Okay. Nobody knows everything. And there is not research done on every single thing, every single material, chemical on this earth. Did you know there is not research done on the drug interactions? On every drug interaction in the world. For every drug, let's say there's 100 drugs and you're testing drug number A. Did you know that there is not clinical studies done on drug number 1 with drug number 2, and 1 and 3, 1 and 4, 1 and 5, 1 and 6, all the way to 1 to 100? Did you know that there is no clinical study done there, right? You see, so when people are fixated on clinical, I love clinical study. First of all, I love research. I'm a biochemist. I love research, okay? But I'm not fixated. I'm fixated on the truth and facts. Like we get this a lot with Chinese medicine. Oh, Chinese medicine can't do this. Oh, it's not been proven. Where's the double-blind study? My question is this: where is the double-blinded study to prove that it can't be done? There's another example. I asked ChatGPT, what is the gold standard of fixing hypertension? And what ChatGPT gave back in regards to fixing was bariatric surgery. I was like, whoa, it was all right. But number one, ChatGPT knows medications do not fix hypertension. But they said bariatric surgery. I'm like, what do you mean? No, that's not right. Because I've treated patients who've had bariatric surgery for hypertension. It didn't fix it. Yes, after they had the weight loss surgery, their blood pressure went back to normal, but maybe for a few months or a year, right? They have to still change their diet, change their lifestyle. They have to change all those things. Otherwise, their hypertension goes back up. Then I typed that back to ChatGPT, and ChatGPT was like, oh, yeah, you're right. And so you got to be careful. Personally, in our clinic, my team, we have helped people fix their hypertension. What is my definition of it? My definition of it is we help them restore their organs so that their bodies heal. The organs are heal and self-training. We retrain their bodies to heal itself to the point where their organs are able to maintain their blood pressure by themselves, even without us. So even after they stop coming to see us, now we give them the tools also of diet, lifestyle, exercise. We give them those tools as well, right? And we help them through this process, but we use my QRA, quick restorative acupressure, to retrain the brain. And once the brain is retrained, we back off. We take away our QRA acupuncture, we take away the herb supplements and their blood pressure. The patients are able to maintain their blood pressure by themselves without us. That's what I call fix. We've done that many times in our clinic. But if you go ask ChatGPT, ChatGPT will never tell you that. But next time you talk with your physician or you're talking with ChatGPT like I am, okay, push back. because not all the information is correct. And use this statement. This is a scientific, this is how you do scientific studies. It's a scientific principle, okay? Absence of evidence does not mean evidence of absence.